Hi, my name is Marty. I'm the President, Founder, and CEO of Haskell Health and Safety Canada, and today's talk is about airborne contaminants and respirator selection. We're doing this because the Ministry of Labour is out blitzing right now until the end of the year, looking for airborne contaminants and hazards. So dealing with respirators is what we're going to talk about today. Out of all the courses that I've authored over my 12 years of doing this, and all the courses that I've trained, respirator seems to be the one that gives employers the most headaches, I guess, the most questions, and they don't know what to do. So I can help with that. Thankfully, there's a CSA Standards Z94.4, which actually lays out everything that you need to know about your respirator safety program, and even has a program administrator in there as well too. If you have any problems with that, call me 855-HASKELL-CA and I'll talk to you about that. Ministry of Labour is out doing a blitz right now, like I said, looking at long latency illnesses, and that's because this has been the highest WSIB cost so far. So 70% of the allowed latency claims over the years the last 10 years have been because of lung cancer, pleural plaques, mesothelioma, said that wrong probably, asbestosis, and chronic obstructive pulmonary disease, which are all respiratory issues, right? Cancer Care Ontario and the Occupational Cancer Research Center estimates about 1,300 people come down with cancer every year in Ontario because of workplace exposure. So thinking about the industrial establishments, ministry is going to be focusing on vapors. If you have products with vapors, that's a liquid that's evaporating. Fumes, like a welding fume, something's hard, we add heat to it and then it gets airborne. And then particulate, which is a fume actually, is a particulate. So is dust, so is smoke and carbon, that kind of stuff too, right? So people can die from these things. So this is the important thing. Looking for lead dust, fumes, grinding, welding, cutting, brazing surfaces, things like that. Ministry will be looking for silica dust, so if you're cutting cement, you're sucking back silica, that you need to have a respirator on. Sandblasting, concrete, whatever. Solvent, vapors, adhesive, paint, strippers, anything that has liquid in it that can evaporate. Check your SDS sheets. Isocyanates or isocyanate vapors from spraying foam. Paint, some of the older paints that are not water-based have isocyanates in them, and carbon monoxide from powered equipment inside or outside and poorly operating, you know, so you get some black smoke from it. Fumes and vapors from heated asphalt and road paving. I used to go around looking for road paving as a kid in the summer. I like the smell of that for some reason, and I know I'm not the only one. Also dust vapors associated with hardwood floor installation. So as an employer, we have to take care of all workers, take every precaution reasonable, and that includes engineering controls for airborne contaminants. So the first thing we want to do is look at ventilation systems if we can't eliminate the hazard altogether. Look at different work practices and administrative controls to try to limit exposure. Those sort of things we can take care of right away. When workers can't be adequately protected by some engineering controls, that's the only time that the ministry says, okay, well then we can go to PPE. Look at PPE, personal protective equipment. So inspectors are going to check for proper controls, work practices, respirators are well maintained, workers are trained how to use them properly. If I walked in as an inspector and that was on the top of someone's head, that's a problem. Respirators are fitted properly, and that's a fit test that has to be done every 2 years by law. And also, if you want to know how much exposure people can take without a respirator, you can find that in Reg 833 for the control of biological or chemical exposure. So next I'm going to talk about PPE, personal protective equipment, and the different types. So industrial hygiene is the study of heat, cold, vibrations, things like that, airborne contaminants. It's been around for years. Industrial hygiene, and the only way that we know in today's 2019 how much of a certain chemical we can inhale without harmful effects, without the benefit of having a personal protective equipment on a respirator, is because they've been tracking this for so many years, right? So airborne hazards are gases and vapors. They're dust, smoke, aerosols, mists, fiber, biological agents. And there's only two types of respirators. There's going to be an air purifying respirator and an air line respirator or an air tank. So air line or air tank. Air purifying respirators, air supplied respirators. Those are the two types. So air purifying respirators clean the air that we breathe in. So you're going to have either, let's say, a filter like this or a cartridge like this, or both. And you have to stick with the same manufacturer. They don't interchange, right? So what this cartridge does is it absorbs harmful gases and vapors, and they have to be NIOSH approved. It says NIOSH right on this. The color coding system is not unique to each brand. It's the same for every brand, okay? So these are, you have to look up to see which one to get. These cartridges are filled with activated carbon, which absorbs the chemicals, the gases or the vapors, and when hard to breathe, usually throw them out and replace them. Filters like this. This is a respirator. This is a dust mask. People call these a dust mask, and they don't consider that that's any kind of respirator. This is actually an air purifying respirator in the same category as this one. Offers the same protection basically from both. Not for gases, not for vapors, right? So it's important that that you understand how to wear this as well. During SARS and H1N1 in Toronto, I was sent down there to do fit testing with Health Canada nurses, and you might be surprised at the type of mask that we were using for SARS and H1. It's these two here. So I mean, people think this is just a silly little dust mask. No, that's protected people from death during those two outbreaks, right? So again, they have to be NIOSH approved, and I'll show you this one here. It says NIOSH right on the bottom there. You can go to Canadian Tire and you buy something like this. It's not NIOSH approved, usually one strap, and it's not good for the workplace. Wear that at home if you like. It's probably great, but not good for the workplace, okay? So let's take a look at air supplied respirators. I don't have any with me today, but a firefighter's tank you're used to seeing, or an airline for someone painting a car in a paint booth. It's fresh air that comes into the environment that they're breathing, right? So it's important that if there's enough oxygen to breathe, then we can maybe purify the air. Oxygen is between 19.5 and 23% oxygen. If there isn't enough oxygen and we're using something like these guys here, who are air purifying respirators, all we're doing is purifying, cleaning up oxygen deficient air. We're going to pass out anyway, right? So the oxygen is very important. So there's two phases to this Ministry of Labor Blitz. It's happening right now. It started at the beginning of September. Today's September 19th, I think. It's going on for a month. The month of September, they're doing compliance efforts, and then after that, they're going to be starting to enforce it and charging people as of October 1st, all the way to December 27th, 2019. So in closing, if you have any questions about this upcoming or this current Ministry of Labor Blitz respirator hazards, please don't hesitate to reach out. And remember, it's way better to control the hazard at the source rather than giving someone personal protective equipment, because if this mask fails your worker, the only thing they have left is nose hairs, the snot in the mucus, and the cilia hairs in their throat to protect them. So let's try to control the hazard as far away from the worker's intake valve as possible. Thanks a lot, and I hope you enjoyed this video. We'll talk to you again. Bye now.